I want to begin with an extraordinary number. 94% of New Zealanders aged over 12 are fully vaccinated. A year ago, achieving that level of community immunity would have been considered incredibly ambitious. But the overwhelming majority of the team of 5 million have done what they've done best this entire pandemic, banded together and turned out to get vaccinated, not just for themselves, but to keep their loved ones and communities safe. And to everyone who's done that, we say thank you. Those high rates of vaccination helped stop a Delta outbreak and have given us a head start on Omicron before it's had the opportunity to become widespread. But the science now tells us that to reduce the risk of Omicron, we need to get the number of people boosted as high as possible and before the outbreak really takes off. To that end today, I can confirm that based on advice from the Director General and the COVID Vaccine Technical Advisory Group, from which we have Dr. Ian Town here with us today, we will further reduce the interval between the second dose and the booster to 3 months. From this Friday, the 4th of February, if you are aged 18 and over and had your second vaccination at least 3 months ago, you can have your booster dose. That means if you received your second dose before or on the 3rd of November 2021, from Friday, you'll be eligible to get your booster. It means that on Friday, 1 million more New Zealanders will be able to get their booster. It also means around an extra 100,000 Māori will be eligible for a booster, representing a 59% increase in Māori eligibility from Friday. And an additional 52,000 Pacific people will be eligible, representing a 47% increase. That brings us to a total of just over 3 million New Zealanders, or 76% of New Zealanders who are fully vaccinated will be due their booster as of Friday. And to this group of New Zealanders, I urge everyone eligible to please go and get your booster as soon as possible. The reason is clear. Vaccination is one of the most important things we can do to prepare for and fight the current Omicron outbreak. And although Omicron is for many people a relatively mild illness, as we have seen, it can be very serious for some and can quickly overwhelm health systems. The booster for people 18 and over reduces the likelihood you will need to go to hospital, and it can also possibly help to slow down the spread of Omicron. What we have seen overseas is that if we experience very high case numbers, this will mean high numbers of our people need hospital care. It would put our hospital system under considerable pressure and seriously disrupt other important health care. The consequences of our nation's health and well-being will be serious. So don't think getting a booster is just about keeping yourself safe. It's about ensuring our hospital and health system is not overwhelmed, so those you love and everyone in our community who needs our hospitals can get the care they need in the coming months. To support our goal of getting as many people boosted as possible, we'll be running a big boost campaign throughout February, asking New Zealanders to get their booster dose as soon as they are eligible, much like we did with Super Saturday. More details will be provided by the Ministry of Health next week. The booster is a key part of our plan to reduce the impact of Omicron, alongside the confirmation of over 50 million rapid antigen tests in the next 2 months to ensure those who need to be tested can be. Our red traffic light settings that remove the risk of large super spreader events, and updated mask guidance, we're well positioned for the inevitable spread of Omicron.
It's also really pleasing to see that Māori vaccination rates are now touching 90% for first dose and 85% fully vaccinated. Kia ora, ngā mihi, that is fantastic. We're also well underway with the next stage of protecting our communities, making the paediatric vaccine available for parents and caregivers to make a decision around vaccinating their 5 to 11-year-olds. And it's great to see that over a third of our tamariki are already vaccinated. The science shows people who are fully vaccinated with 2 doses of the Pfizer vaccine are well protected if they are infected with the Omicron variant, especially from becoming seriously ill. We've seen the impact of this most recently in our Delta outbreak. However, the protection does wane over time, and it appears from the emerging science relatively quickly for protection against the Omicron variant. hence the need for boosters. The good news is that there is clear evidence that with that booster dose of the Pfizer vaccine, that people's protection goes back up to a similar level to what it was for Delta with the 2 doses. And that is well over 90% protection against serious illness or hospitalisation. The evidence also suggests that there is some protection from the booster against getting infected by or transmitting COVID-19 to others, and we continue to watch the evidence to see that emerge. Now, with Omicron rapidly becoming the dominant form of the virus internationally and now here in Aotearoa, it's important that we do everything we can. Moving to this 3-month interval is an important measure in our efforts against Omicron, and I want to urge everyone to make a plan to get your booster as soon as it is due. Whilst we can't administer boosters to everyone in that 1 million on this Friday, I can assure you we have excellent capacity across our system, and we certainly have a good supply of vaccine. It's even more important that people at serious risk of either getting COVID-19 infection or of suffering ill consequences of it get their booster doses, and that includes our border and healthcare workers, many of whom are already boosted and who are required to be boosted by later this month, our older people, all Māori and Pacific people, people in aged residential care, and people with underlying health conditions, including mental health conditions. There is considerable work underway by our teams to make sure that boosters are easily accessible to these groups, and likewise we have got a lot of work underway to improve access to the vaccine, the paediatric vaccine for our tamariki Māori and Pacifica over these coming weeks. We want to see their rates of vaccination also increase. And finally, just some information on boosters and side effects. International data does show that boosters have a very good safety profile, and I'm pleased to say we are seeing a similar pattern here in Aotearoa. With now well over 1 million doses of the Pfizer vaccine administered as a booster here, our data suggests that it follows a very similar safety profile to the second dose. In general, we've found that it's the second dose that people report the most side effects from, but the side effects from the booster are of a similar pattern. We've not seen an increase in those common side effects such as muscle aches, pain at the injection site, nausea, headaches and so on. For most people who do get these, they're mild and don't last long. Overall, our reports of adverse events following vaccination have declined after each additional vaccination. And this is particularly so, importantly, that at this early stage, we haven't seen an increase in the reported rate of those very rare but more serious side effects that we monitor closely, and that includes severe allergic reactions like anaphylaxis and, of course, also the inflammation of the heart, myocarditis. Finally, I know there's a lot of interest in whether and when 12 to 17-year-olds might be able to receive a booster dose. I've asked for advice on this from the technical advisory group that Ian Town chairs, and I'm expecting this next week. At the same time, our operational teams are looking at what it would take to implement the changes to roll out such a program should the science and our other advice support that a booster for all or some of that age group. So we will be providing that advice to the government in the next couple of weeks.
Thank you. Kia ora. Yes, so the original interval, as you know, from the trials was 6 months. We moved last year to bring that down to 4 months. The reason for that, as you know, is that the antibody levels tend to start going down after 2 to 3 months, and that's why the protection afforded is not quite as good at the latter part of that 6-month period. So bringing it forward to 3 months now, as they've done in the UK very recently and in most Australian states, really means, as the Director General has said, that we can get that level of antibodies and other immune protection at a peak before we're facing widespread community transmission. 3 months between doses of a vaccine is pretty much spot on, so there doesn't appear to be any downside, and as the Director General has observed, we're not seeing any changes in the side effect profile.